Okay, now electroconvulsive therapy, which is frequently referred to as ECT, is a treatment that's usually reserved for people who are suffering from really profound depression. Like they are deep in the depression. They may be suffering from suicidal ideation, where they are so fixated on achieving suicide that it's all they can think about. It's all they do. It's all they try to do every time they're given a moment alone. And the people who are treating them really need to come up with something that will stop that drive to suicide. Now this looks kind of gruesome, even though they put him in colorful underwear in this drawing. By the way, they usually don't put you in your underwear. You're in like, a hospital gown. But ECT is a treatment where we use electrodes, one on either temple, to send a very mild electric current from one electrode across your brain to the other electrode, and that triggers a convulsion. So that's why it's called electroconvulsive therapy. We're going to use electricity to trigger a convulsion. The patient is going to be given a general anesthesia, so they're asleep, and then a muscle relaxant so that the convulsion doesn't leave them, really sore the next day. And the goal is to trigger a convulsion that lasts 60 to 90 seconds to achieve a full benefit. What is thought to happen during that stimulation with the electrodes is that it resets the functioning of the synapses so that they start to fire the way that they would normally do when they're healthy. There are people who have profound depression, get treated with one session of ECT, and never have a symptom again. I had a student who told me her father had been battling depression for her entire life, and when she was about 15, he underwent ECT, one treatment, and now it had been 20 years and he hadn't had another recurrence of his depression. That's a pretty great and dramatic example. More commonly, people may need a couple of sessions of ECT to really get the full benefits. Now, back in the olden days, they tried all sorts of different things to cause shock. They used to call it electroshock therapy because they would use sugar shock to try and drop a person's blood sugar till they go into unconsciousness and then get them sugar to bring them back, and that was supposed to reset the synapses. They've tried a lot of different kinds of things to put you into shock. Those earlier treatments were really pretty harsh and harmful. I mean, the early electroshock therapies caused pretty widespread amnesia in the patients. When they woke back up, they didn't remember a lot of things that they had known before. Ernest Hemingway supposedly had this kind of treatment, and he ended up committing suicide because he was in despair over what he says he lost through the treatment. Well, he obviously got the treatment because he was pretty depressed anyway, so I'm not exactly sure what role, and that was a long time ago. In modern ECT, the electricity is so mild, and the medical treatment surrounding it, the generalized, unconsciousness and all the stuff that goes with it, usually the person doesn't remember the treatment at all. If they have amnesia, it's usually for certain specific events that happened while they were just while they were depressed. And that actually might not be due to any kind of brain changes. It might have to do with state-dependent memory that we talked about earlier in class. That when you're depressed, you remember things that have to do with depression. And when you're non-depressed, it's kind of hard to remember those things. It's hard to retrieve them. They're still in there, and if you got depressed again, you'd probably remember them again. But when you're in a non-depressed state, it's hard to remember those depressing events. So most people who have gone through modern ECT do not report amnesia as a side effect, but they do report significant improvements in their mood, and the suicidal ideation tends to go away. And in fact, I have this video that comes out of a pretty old documentary from like the 90s, but the patient was just determined to kill herself when she was admitted to the mental hospital. And they interviewed her, and she said, I'm horrible, I'm disgusting, I smell bad, I think the devil's inside of me, I deserve to die. And she reported it with such flat affect. She was just absolutely emotionless. And then they gave her one treatment of ECT, and then they brought her in and interviewed her again, and she was kind of like, well, she was she'd say, "Oh, I don't really remember much about the depression." And then she's like, "Well, I do remember thinking that the devil was in me." And then she kind of laughs, like, "That's so ridiculous that I would have thought that." She's like, I, okay, so I do remember saying that. And yeah, I do remember taking a whole bottle of aspirin on Thanksgiving and then telling my son to go get his dad because I didn't want to leave him alone and stuff. Um, the memories did come back to her. She claimed at first she didn't really remember anything, but then she's like, okay, yeah, I do. I'm kind of embarrassed to say them because she felt really bad about things that had happened while she was in the depression, which is a symptom of improved mood. That she's looking back with, first off, she kind of was able to laugh about it. That's a good, healthy thing to do. And then she realized it was pretty ridiculous that she thought that there was a devil in her and that she doesn't deserve to live and things like that. It worked really well and really fast. And so now some states outlaw this because it looks pretty gruesome, right? It looks like Frankenstein. It looks like you're going to shock somebody and then they're going to wake up. If any of you have ever seen One Flew Over the Cuckoo's Nest, a lot of medical treatments got bad raps from that movie. And ECT was one of them. They depict it like he's going to wake up and not know who he is and stuff like that. And so some states actually outlawed this treatment. But in those states where it's allowed and it's used correctly, it seems to work pretty well. Now, something that's more modern and a lot less invasive is repetitive transcranial magnetic stimulation. Now, instead of using electricity to try and reset your synapses firing, now we're going to use a magnet. If anybody's ever had an MRI on their head, they know that when you come back out of the MRI, you do feel a little odd. MRIs are just magnetics. And so why would your brain feel like, why would your thoughts feel odd after you've been in a big magnet? Well, what happens is the magnet can pull parts of the little ions and molecules that are in your brain into different positions, and it can actually open and close different ion gates on your axon, stuff like that. So the idea is that it resets your neurons into their correct firing position so that they're ready to function in a healthy way. You'll notice he's sitting there with his little chin in a chin rest and his forehead against a thing so he doesn't move. And then he doesn't feel anything per se happening. He'll hear like some mechanical sounds and stuff like that, but it doesn't feel like anything really per se, but he'll feel better after the treatment's over with because of what the magnets have done to his neurons. Now here's a nice invasive technique that we really don't do very often anymore, and that's a lobotomy. Here we have this guy who invented the lobotomy, and during his heyday, he would go from mental hospital to mental hospital. They would put patients who had all sorts of different symptoms, not necessarily aggression, but all sorts of symptoms on gurneys, and then just kind of roll them past him. Look at it, he has no gloves on, and he's just going to treat patient after patient. And in the hallway, they just roll the patient past, and he's going to perform a lobotomy next, and then like that. And he would do like 20 or 30 lobotomies in a day at the mental hospital that he was visiting, and then go on to the next one. The premise was that we're going to try and sever the connections between your limbic system, where your emotions come from, and your frontal lobe, where your ability to plan and decide how to act is. If we can separate your emotions from your ability to plan, we should be able to make you less aggressive and make it easier to care for you while you're in a mental institution. Now in the picture on the upper right, you see what he's actually doing. He takes it's a device that basically looks like an ice pick, but it's medical. He slides it in the eye socket past the eye, not through the eye, but alongside the eye. Then he has to use that little hammer that he's got there, and he taps it to get it through that back socket of your eye. And he has to pierce what's called the dura mater, which is a really thick, like Ziploc baggy quality thing that encases your brain. He's got to get through that. Then he sticks the ice pick into the brain and then sort of just waves it around. Hoping that he's going to hit those nerves and sever them. Of course, he's hitting other stuff too and sort of scrambling it up. So people who had this treatment, when they woke up, they not only were less aggressive, but they also, because their frontal lobes were damaged, were a lot, their personalities were altered. And they oftentimes were very immature and lost some of their adult thinking. And that's because frontal lobe is really important for those things. And if you damage it, you're going to lose some of that functioning. Today, we rarely do this kind of lobotomy, this kind of psychosurgery. Instead, if you do have a patient who's going to be in a mental hospital, has no chance of ever getting out, and they're behaving violently towards their caregivers and the other patients, usually we try chemical lobotomy, which is basically medication, right? Tranquilizers, stuff like that. But sometimes they don't work. Sometimes the patient refuses to take them, things like that. So we could try a modern lobotomy, which is where we use an MRI to specifically locate those nerves that need to be severed. And then you take an electrode that is the thickness of a human hair. You drill some very tiny holes through the skull and the forehead. You put the electrode through the hole, wend its way into the brain. Following the MRI, you can see the little electrode on the MRI. You get it located so it's right up against exactly that nerve. A little pulse of electricity comes through and burns the nerve. And then you very delicately pull the hair back out. And that way you've targeted specifically the nerves and nothing else. And in those cases, you end up with a person who still really can't get very emotional. They can't get very angry, so that's good. But they also can't get very happy. You know, those things are lost also. But they're at least now safe. For the people who have to work with them, you know, they're not in a straitjacket all the time or wearing a mask so they don't bite people, and you know what I mean, which is very dehumanizing and very creepy. So at least now they're a person who can walk through the mental hospital with, you know, people treating them like a regular human. All right, well, that's a sort of a unhappy message to end out on. So I thought maybe I'd just say some encouraging words. Hopefully you enjoyed introductory psychology and will be more interested in pursuing another psychology class in the future. I hope you enjoyed my lectures, didn't find them too boring. And you know, if you're looking at Psych 200, look me up because I tend to teach that quite frequently. All right. Thanks for listening.